Okay, part 2 of the Marine. And what's your name?
Terry.
Terry, I'll call you Mrs. ADHD. And you are?
Will.
You never stop moving, just moving. Will. And you were in the Marine for?
A lifetime.
Lifetime, and your health care is good.
Yeah. What do you like about health care in Canada? I mean, we hear that it's terrible, that you have to wait 6 months to get a operation or something.
Well, you know, of course, I know some people that is who you know, then you'll get faster. Right. There's no question about it. I know of one case. As a matter of fact, it was my father. He found out he had cancer. My sister is a family doctor. Bang, 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 bang. True, done in about a month. Right. And it shouldn't happen, but unfortunately it does. And but we could still go in the hospital. They don't ask us to pay, and we don't have no bills. But
now here in Fredericton, this is a big enough city. You have a hospital, you have doctors.
Yes.
If you had to have heart surgery, you could get it here.
Yeah.
Now up on Cape Breton, there's not a big hospital up there because it's out rural.
Yeah.
But they'd come to the next city.
Yeah, and same thing here. Okay. Same thing here.
But they'd have to get on a list, wouldn't they? I mean, I've heard that.
Like I'll be honest with you. I had a doctor for 20 years, and he left. He went to Prince Edward Island, where you took your beautiful sunset. See, that means I pay attention to what you were saying. He left, and it took me. I just got a doctor. I'm going to see my doctor for the first time on August 9th. And I haven't had a doctor for a year and a half. So what they have is walk-in clinics. You walk in there, the doctor sees you, but it's not the same like to have your personal doctor. But we are having problems here in New Brunswick to find a doctor. Do you got a problem down the States?
We're going to see that because they've done some changes to the healthcare laws. And that is a big thing with Obama. A lot of people didn't agree with that. It was pushed through. And a lot of Republicans didn't want that health care.
Yeah, no.
Because we don't have enough doctors now. When you go to a doctor in America, he can be your doctor. You still might wait you might get out of the waiting room into your exam room, but you might wait an hour if you're lucky for him to get to you. And it's getting worse. And a lot of doctors are retiring and getting out of primary care because they have so many patients. And it's only when they dump all these more people that have to have health care now, because now in America the new law says that if you don't get it, you're going to be fined. So when this all goes into effect, I think it's 2013 or 12, they're saying they have to have health care or they will be fined.
Change the subject. Who's the brainstorm that decided to borrow money from China?
Oh, yeah.
That started about 30 years. That started a long time ago.
Before Bush?
More before Bush.
Really?
We've been rolling over the debt, you know, since World War II, but now it's just out of hand. Now it's just
crazy, yeah?
Yeah. Now it's just.
What are you guys going to do?
God, I don't know.
If they don't pass that debt by August 2nd, if they don't raise the debt ceiling, we're in trouble.
They've been saying that for 30 years, and they keep, kicking the can down the road. And so, I mean, they'll do the same thing. It's like your house payment. They'll mortgage you out farther, keep the payments low.
Yeah. Well,
no, I mean that's what they'll do.
Right quick, how was the disaster on the coast?
On Katrina?
Yeah. No.
He's talking the oil.
Yeah, the
oil. We were actually gone last year. Right when it happened, when we left like 2 or 3 days later on a trip, we were gone like a month, and I looked on TV and it's like still spewing away. Now they say that the Gulf, that they've got it contained and stuff, and the beaches are back safe and all. I have not been down to see it.
Haven't seen it?
No. But that was supposedly bigger than the Valdez.
Oh yes.
I mean, more cubic barrels of oil or tons or however they measure it. But
did you see a lot of wind farms down the here and down the States? Where do you see more?
Down in the States. Out west, we saw some in Oregon.
Oregon?
Up, Columbia River where the wind is high. But I've seen more here. Yeah.
More here?
Yeah.
In the Maritimes?
Yeah.
Or New Brunswick?
PEI? I have.
So the most wind farm you seen was here?
Was in Canada, yeah.
Canada. Interesting. So that's
It's an amazing place. It's a wonderful place.
So nice city here.
Yeah.
Beautiful city. When you guys, is that your little wagon there?
Yeah. That's what we travel around.
You got a gun in there?
No.
I don't want to know that.
No, we're not.
Can't carry one.
Can't go.
No, I looked on the State Department, all the regs and stuff got going, and it's like so many restrictions, and everything I read was like, you don't need a gun up here.
No.
You don't need protection. And
No, you just need your fist and your former Marine, no problem there.
And sure enough, I mean, like I said, I've walked around everywhere, and it's been no threat.
Unless you're shopping, unless you're not shopping, unless you're going hunting.
If you want to look for trouble, you'll find it.
Yeah.
If you want to look for it, you will find it. Trust me, you will find it. Listen, nice to meet you.
Sure thing.
And Mrs. ADHD, nice to meet you. Talk to you later.